The effects of having a stroke on a loved one, a coworker, someone you know, a friend, can be devastating, life-changing, and not in a good way. But early identification and treatment are key in preventing residual effects of stroke, like loss of speech, loss of movement, and paralysis. These are important things that we need to think about when we go to identify a stroke early and treat it. So this video is dedicated to identifying those signs and symptoms of stroke, the BEFAST acronym. Hey, it's Bob again on the channel. We're down here on Chincoteague Island, down at the ocean, down on the Atlantic Ocean in Chincoteague, Virginia. I want to talk to you today about health and retirement. My channel is called Quit Happens. It's okay to walk away. Well, part of that, once you quit, once you retire, once you move on, is taking care of yourself. That's a part of my job. My new job is taking care of myself. Part of that relaxation is being out here in the afternoon and being able to watch the ocean, listen to the ocean, and relax when I'd ordinarily be working. The risk here is getting wet. I'm getting a little too close to the ocean. So what I want to talk to you today about as a retired nurse, whoa, is stroke and how to be aware of the signs and symptoms of stroke. There's an acronym called BEFAST. B-E-F-A-S-T is the acronym. And the T is for time. Time is the most critical aspect when it comes to stroke and somebody showing signs of a stroke. It's important because stroke can be treated and in some ways reversed. Some people don't even have residuals after they receive proper treatment in a timely manner. That being either medication, when a person has what they call a thrombotic stroke or a stroke from a blood clot, and also the retrieval of that said clot can happen and symptoms can completely go away. So what does the BEFAST stand for? B, that's balance. As you can see, I lost my balance earlier. That's critical. Had I not been walking on the beach, that might have been a sign of stroke. So if somebody's having issues with balance, start thinking stroke. E, eyes. Starting to have visual problems. Can't see out of one eye, can't see out of both eyes. Some different visual problems. Say balance, eyes. F, that's face. If you notice a droop in the face, facial droop is a telltale sign of stroke and needs to be treated. If a person's actively having a stroke, again, call 911, do not delay. Medication, getting medication to a patient with a thrombotic stroke, time matters. A, arms. If there's weakness in one side or the other, or a droop, if you have a person put out both arms and one of them kind of droops down, that is a sign of a stroke. Possibly. Take this very seriously. S, speech. So if the person's having problems with their speech, it's slurred, doesn't make sense, different than what you're used to, be thinking about stroke. T is time. We talked about that in the beginning. Time. If you see these signs, the BEFAST signs, it is time to think about calling 911. Don't delay. your loved one, your friend, whoever it may be. That time is critical to make sure they don't have residual from a stroke, like loss of mobility, loss of speech, loss of cognition. It's very important. Please make sure that if you see people with sign of stroke, that you are fast in calling 911. Thank you for taking this time to watch my video, and have a great day.